Assalamualaikum warahmatullahi wabarakatuh. Uh, I want to introduce myself. My name is Muhammad Ilman Khasol. I'm from Medical Faculty of Unisula. Today I'm gonna tell you about the concert. I'm gonna share my screen. Uh, Point 1A is identification as a randomized trial. In the title, there is a title. The title of this article is Effect of Early Treatment with Ivermectin among Patients with COVID-19. And the second is uh, scientific background and explanation of rationale. Wait. It is the scientific background and explanation of rationale. Although the vaccine against severe acute respiratory syndrome coronavirus, the virus that cause coronavirus have been developed and distribute. Major challenge remain regarding vaccine production and allocation. And I'm gonna move to the next point is specific objective or hypothesis. And this is the specific objective or hypothesis of the researcher is to evaluate of efficacy of ivermectin for prevention of progression of COVID-19, resulting in hospitalization among outpatients with SARS-CoV-2 infection. We conducted randomized placebo control adaptive platform trial together in the state of Minas Gerais, Brazil. It is the hypothesis of the researcher. And then we move to the third point is method. The first method is trial design. It is the trial design. Trial design is description of trial design, such as parallel, factorial, including the allocation ratio. Although various interventions were assessed in this trial, we report here on the use of ivermectin at a dose of 400 microgram per kilogram of body weight for 3 days as compared with placebo. And we move to the next point is important change to method after trial commencement with the reason. And the researcher gave the important change to method after trial commencement. The initial trial protocol specific single-day administration of ivermectin, and we recruit 77 patients to this dose group. On the basis of feedback from advocacy group, we modified the protocol to specify 3 days of administration of ivermectin. Here we present the data only on the patient who had been assigned to receive ivermectin for 3 days or placebo during the same time period. And the full trial protocol was approved by local national research ethics board in Brazil and by the Hamilton Integrated Research Ethics Board in Canada. And then we move to the next point is the participants. The participants on this point. The potential participants were screened to identify those meeting the eligibility criteria. Inclusion criteria were an age of 18 years of older, presentation to an outpatient care setting with acute clinical condition consistent with COVID-19 within 2 days after symptom onset, and at least at one high-risk criterion for progression of COVID-19, including an age older than 50 years, diabetes mellitus, hypertension, leading to the use of medication, cardiovascular disease, lung disease, smoking, obesity, defined as body obesity, mass organ transplantation, chronic kidney disease, on the receipt of dialysis, immunosuppressive therapy, a diagnosis of cancer within the previous 6 months, or receipt of chemotherapy for cancer. Patients who had been vaccinated against SARS-CoV-2 were eligible for participation in the trial. Further inclusion and exclusion criteria are listed in the trial protocol. And we move to the next point again. That is settings and location where the data were collected. And the setting of data were collected available at negem.org, and an investigator of the 12 participating clinical site. And we move to the next point is point intervention. The intervention for each group with sufficient details to allow replication, including how and when they were actually administered. Patients who were shown a welcome video with information on the trial, ivermectin, adverse event, and follow-up procedure. And we move to the next point. This next point. Next point is outcome. Completely defined specific primary and secondary outcome measure, including how and when they were assessed. The outcome measure. The primary composite outcome was hospitalization due to COVID-19 within 28 days after the randomization, or an emergency department visit due to the clinical worsening of COVID-19. Within 28 days after randomization. That is the point of outcome. And we move to the next point. It is the point of outcome. Okay. The event of adjudication committee whose members were unaware of the randomized assignment, just to the reason for hospitalization or prolonged observation in the emergency department as being related to or unrelated to the progression of COVID-19. Secondary outcome including SARS-CoV-2, viral clearance at day 3 and day 7. Sorry. And we move to the next point. We have a sample size. When applicable, explanation of any interim, analyze, and stopping guidelines. Interim analyses were planned to occur after 25%, 50% and 75% of the maximum number of patient outcome has been observed, as well as the trial completion, as well as the trial completion. The poster efficacy threshold was set at 97.6%, and the futility threshold at 20%, 14%, and 60%. If the intervention group showed the poster probability of efficacy by crossing boundary, it was to be stopped. That is the point. And we move to the next point is move to the blinding, section blinding. We move to the section blinding is the if a Dan who was blinded after the assignment to intervene. If Dan who was blinded after assignment to intervention. For example, participant, correct provider, those assessing outcome and how. And that point is this. The intention to treat population included all the patients who had undergone randomization. The modified intention to treat population included all the patients who received ivermectin or placebo at least 25 hours before a primary outcome event. The per protocol population included all patients who reported 100% adherence to the assignment regimen, although all the participants who had been assigned for 3 days or 14 days. And we move to the next point is statistical method. Statistical methods used to compare group for primary and secondary outcome. Is the point. The characteristic of the patient at baseline are reported as count as and percentage or for continuous variable as median with interquartile range. We applied a Bayesian framework to assess the effect of ivermectin as compared with placebo on the primary outcome analysis for the analysis of the secondary outcome. And you can read it, the rest of it. And we move to the next point. A method for additional analyze, such as subgroup analyze and adjusted analyze. Where's the point? Oh. It is the point. The primary outcome was also assessed in subgroup defined according participant age, body mass index, status having cardiovascular disease or lung disease, sex, smoking status, and time since symptom onset. The framework of our analysis, we didn't test for multiplicity. We assess time to event outcome using Bayesian Cox proportional hazard models. Yeah, they use a Bayesian Cox proportional hazard model. And we move to the next point. Is the result. In the point of result is the participant flow. And for each group, the number of participants who were randomly assigned received intended treatment and were analyzed for the primary outcome. The trial population. Yeah, as you can see, it is the result, and the trial population is the point of a participant flow. A total 10,467 outpatients were screened for inclusion in the trial. Of this, 1,358 patients were randomly assigned to receive either ivermectin or placebo. That is randomly assigned to receive either. This is the randomly population. And we move to the next point. Is baseline that no, I'm sorry. Number analyzed. The number analyzed. The median age of patient was 49 years. And 791 patients were women. Most of patients identified being mixed by race, identifying as white, as black with respect of to coverages. The data in table 1 suggests that the group were generally well balanced. The mean number of days with COVID-19 symptom were randomization was 3.8 plus mean 1.9. And that is from the number analyzed. We move to the outcome and estimation. The outcome and estimation, the outcome and estimation. This is the outcome and estimation. For each primary and secondary outcome, result for each group, and the estimated effect size and its precision, such as 95% confidence of interval. And the probability that percentage of patient with a primary outcome even was lower in the ivermectin group than in placebo group. And we move to the next point. The next point is ancillary analysis. Ancillary analysis is result of any other analysis performed, including subgroup analysis and adjusted analysis, distinguishing specified from exploratory. Subgroup analysis. The evidence of a treatment effect with ivermectin as compared with placebo in subgroup defined according to the patient age, body mass index, status of having cardiovascular disease or lung disease, sex, smoking status, blah, 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 blah. We move to the next point. Next point is harms, all important harms or unintended effect in each group. For specific guidance, where is the harms? This is the harms. Similar results were observed in the modified intention to treat population. Relative risk is 1.89. Yeah, this is the point. And then we move to the next point is discussion. The first point of discussion is limitation. The trial limitation addressing source of potential bias, imprecision, and if relevant, multiplicity of analysis. Wait, let me find it. Yes, this is the point. When we began this trial, we randomly assigned patients to receive 1 day dose of ivermectin, as is most commonly used for the treatment of parasitic disease. We responded to the feedback of advocacy group regarding to this administration schedule and adapted the duration of ivermectin administration to 3 days at relatively high dose as compared with the most of trial of this drug. And then we move to the next point is generalizability. The generalizability is external validity, applicability of the trial funding. Is the point of generalizability. Given the public interest in ivermectin and support of it used by paramedical group, we suspect that there will be additional criticism that our administration regimen was inadequate. Detail of pharmacology, rational, and mechanistic hypotheses for ivermectin use are provided in the supplementary appendix. And the next point, after the generalizability, is interpretation. In this randomized trial, the administration of ivermectin didn't result in lower incidence of medical admission to a hospital or prolonged emergency department observation for COVID-19 among outpatients at high risk for serious illness. And we move to the next point. Oh, I think it's from the top of the article. Sorry, let me first second. Yeah. The verse is it is the from point other information such as registration, protocol funding, and the first is registration, the registration number, and name of trial registry. The first we have registration is the clinicaltrial.gov